My name is Dan Drummond. I'm the Director for Primary Healthcare Services for the Touchwood Qu'Appelle Network. Primary healthcare. It's about providing the right service, the right provider, at the right place, at the right time.
Primary healthcare is a coordinated approach to your everyday healthcare needs. Primary healthcare is client-centered. Together, you and a team of healthcare professionals work to prevent illness, promote healthy living, and manage your unique health needs. Improving access. You have access to the information and services you need.
I'm Lisa Plank. I'm one of the nurse practitioners in Balcarres. Access is an important pillar of primary health care. We've been able to provide access to patients in two ways. One, by providing regularly scheduled booked appointments for people to be able to manage their chronic conditions like diabetes. We've had the benefit of being co-located with multiple professionals in visiting services that enable us to work collaboratively with them, including diabetes education, mental health, public health, and other visiting services. That opportunity of being co-located lets us manage those patients more efficiently. We can have those hallway conversations that make a big difference in providing that ongoing care to patients.
Building relationships. You have a relationship with your healthcare team members who support you in managing your health.
Transitioning from an acute care facility to a primary health care facility was a challenge in this community. Finding ways to continue to provide high quality care for patients that met patients' needs enabled us to build quality relationships with patients, for them to feel comfortable that there was continuity of service, that they were going to have a place to have their care needs met. We've made some choices, including providing a regular, consistent walk-in service that provides access to patients to get their more urgent or immediate care needs met by having 2 full-time nurse practitioners at this site.
Developing teamwork. You, your healthcare providers, and your community all work together for good health.
My name is Ali Wasegi. I am a physician for RQHR rural practice team, and I started my rural practice in October 2013. It's almost 1.5 years that I practice in rural center. I think it's a unique center, and for rural practice, it's a good example of doing lots of medical and health service just in one center. And I personally, as a physician in this team, I am happy with that. I know that still there are some parts that we have room for improvement, but overall it's a really good experience. Team working, all the main part of health service in one center.
Hello, my name is Arlene Rogers. I am the primary healthcare nurse at Fort Qu'Appelle Primary Healthcare. Since I've started this job a year ago, my position has evolved in that I am working closely with the physicians, with the diabetic educator, with home care, with other disciplines to ensure that patients with chronic diseases get the care that they need to be able to manage their conditions.
My name is Shannon Rogers. I'm the case manager for home care here in the Fort Qu'Appelle area. I think one example of how teamwork has improved with the primary health care initiative is that an example, the other day, one of our clinic assists had made a phone call to a client to change a doctor's appointment, and in that conversation some concerns were raised. She felt that the client was possibly a little confused. So when the individual came the next morning to see the doctor, she came and got me, personally took me down and introduced me to that individual, and we were able to have a conversation about how she is managing at home prior to the doctor coming in to do his examination. So once the doctor did come, the 3 of us were able to have a conversation to see what kinds of help might be needed in this person's home, and we came up with a plan where we're going to have our home care nurse monitor the individual on a weekly basis just till we get an idea of how she is managing at home and if there are things that we can do to support her in that environment. It worked out really well. We came away with a plan and a signed physician's order, and we're going to continue to monitor this person.
Knowledge. You have the information you need so you can lead a healthy lifestyle and prevent illness.
One goal is to provide clients with the knowledge on when and how to access the right services for their health needs. The Touchwood Qu'Appelle Network has recently completed the initial phase of the patient experience survey. The results show we're doing well in many areas. However, we have work to do around and improving on how our clients feel comfortable in managing their care at home. We've been looking at opportunities that present immediately after a diagnosis of a chronic condition to start the education process.
I have lived in this community my entire life and have used the services offered by the medical clinic and doctor for years. I have renal cell carcinoma and have had it since January of 2013. And so my requirements for medical services are fairly acute. I have also suffered from many other ailments that are not necessarily related to my cancer. Since the interruption of services with my deceased general practitioner, I have found that the service from the home care team is beyond what I could have ever expected. The home care workers take time to come to my home to check on me, and they do not try to cut any visit short. Their care and attention to my condition is beyond any of my expectations. They ask many questions, and they take the time to understand my needs. At my last visit, in fact, I had asked for another soft neck brace because the only one that I had was required for bathing. The home care worker called the hospital to see if there was another one available. And when there was one available, the home care worker went and picked it up for me. Now that is customer satisfaction. But perhaps the most notable difference is when you come in to see a physician. There is no stand at the desk and wait until the receptionist notices you. You are greeted in a friendly manner, and in a few minutes you are taken in to see a doctor. My experiences with the doctors are positive. They take their time to listen to you, the patient. They are not on the clock. So they take their time to make their diagnosis of what is ailing you. All of the doctors use the electronic medical file system. So no matter which doctor you see that day, your file is up to date and accurate. So in summary, this center offers all the services that a patient could ever want in a rural town. We have here in this center a large number of doctors to see you at any one time. Dietitian services, mental health, and home care. All of these services in one center make this facility a success. Thank you.
The list of people and departments who helped us in the development of the Touchwood Qu'Appelle Primary Healthcare Network is huge. Let me say, to accomplish what we've done so far and what we hope to plan and accomplish in the future was and is only possible because of the caliber and dedication of these people. On behalf of the region, Ministry of Health, clients, and myself, all I can say is thank you. I hope you are proud of what you have accomplished. David Yee, who you saw earlier in the video, was someone who cared deeply for his family and his community. When approached to share his story, he agreed with no hesitation despite failing health. David passed away April the 3rd. He will be missed.